Ulcerative colitis is one of the subsets of inflammatory bowel disease, the other one being Crohn's disease. Ulcerative colitis is typically diagnosed at a younger age, typically in the teenage years or your 20s, although it can be diagnosed later in life as well. A lot of patients will have a strong family history of inflammatory bowel disease like ulcerative colitis or Crohn's disease. When patients present for the first time, they typically will note that they have a large amount of diarrhea that can frequently become bloody and is often associated with abdominal pain. Patients may also notice that they've had a hard time maintaining weight or maintaining adequate nutrition. Diagnosis is a multidisciplinary approach. It's usually between your primary care physician, a gastroenterologist, and sometimes a colorectal surgeon as well. Diagnosis, it involves multiple steps. Usually a CAT scan is obtained to see if there's any acute inflammation of the colon, and then a colonoscopy will need to be performed as well to assess the amount of inflammation within the colon. There are also some lab tests that can be performed as well that help support the diagnosis. The good news is, especially in 2020, ulcerative colitis is a very treatable disease with medical therapy. There are a lot of medications like Remicade, Humira, and a lot of the new medications you see advertised on television that can really control your symptoms and avoid you needing any type of surgery in the future. There are a few patients with ulcerative colitis that do require surgical intervention. There's a very small subset that would present to the hospital with a very acute flare of colitis. This can either be severe bleeding or even sometimes a rupture or perforation of the colon. This is rare, but it can require emergency colon surgery and sometimes an ostomy bag. There are other patients that are followed along well, they're on medical therapy, but because of their disease process, they stop responding to the medical therapy. At that point, a discussion is had between the gastroenterologist, the colorectal surgeon, and the patient to see if they're a candidate for an elective removal of their colon. Typically with ulcerative colitis, when we electively remove the colon, we take out the entire colon and the rectum, and we do some type of a reconstruction of the rectum, which is also called a J-pouch, to help patients have function and continence going forward. The reason this is done is because there's such severe inflammation that medication is not helping the patient anymore, and also there is an increased risk of developing colorectal cancer over your lifetime if you have ulcerative colitis. That's why we remove the entire thing at the time of surgery. The good news is most patients don't require this because of the excellent medical therapy, but we'd be happy to talk to you about the process at Memorial Advanced Surgery.